Welcome to this Nclex mastery session on cast care, traction, and compartment syndrome. These are high-risk musculoskeletal topics where subtle assessment changes can signal serious complications. You'll face 50 challenging clinical questions designed to test your understanding of neurovascular assessment, cast complications, traction management, and compartment syndrome. Read each question carefully and choose the single best answer. Question 1. A client is admitted after sustaining a closed tibial fracture and has a newly applied long leg cast. 6 hours later, the client reports that the pain has become increasingly severe despite receiving the prescribed opioid. The nurse observes that the affected calf is tense and swollen. The client states that the pain becomes significantly worse when the nurse gently dorsiflexes the client's toes. The dorsalis pedis pulse remains palpable and the toes are warm. Which finding is most concerning for an evolving complication? A. Pain with passive stretching of the toes. B. Warmth of the affected toes. C. Presence of a palpable dorsalis pedis pulse. D. Mild swelling immediately distal to the cast. Answer: A. Pain with passive stretching of the toes. Rationale: severe, progressively increasing pain that is poorly relieved by analgesics, particularly pain with passive stretching, is a classic early finding of acute compartment syndrome. A palpable pulse does not rule out compartment syndrome because major arterial flow may remain present despite critically elevated compartment pressure. Question 2. A client returns to the orthopedic unit after application of a fiberglass cast for a displaced ankle fracture. During the first neurovascular assessment, the nurse notes that the toes are warm, pink, and have brisk capillary refill. 4 hours later, the client reports increasing pressure underneath the cast and new tingling in the toes. Which nursing action is most appropriate? A. Place the affected extremity in a dependent position. B. Notify the healthcare provider of the new neurovascular changes. C. Insert a padded object beneath the cast to relieve the pressure. D. Reassure the client that tingling is expected during the first 24 hours. Answer: B. Notify the healthcare provider of the new neurovascular changes. Rationale: new paresthesia combined with increasing pressure beneath a cast may indicate developing neurovascular compromise or compartment syndrome. The change from the client's baseline assessment is clinically significant and requires prompt evaluation. The nurse should never insert objects beneath the cast. Question 3. A client with a femoral fracture is placed in skeletal traction. The prescription specifies 7.5 kilograms of traction. During the assessment, the nurse notices that the weight is resting against the floor rather than hanging freely. The client's leg appears properly aligned, and the client denies increased pain or numbness. What should the nurse do? A. Increase the traction weight until the prescribed force is restored. B. Remove the traction temporarily and place the weight on the mattress. C. Ask the client to pull against the traction to restore the prescribed force. D. Correct the traction setup so the prescribed weight hangs freely. Answer: D. Correct the traction setup so the prescribed weight hangs freely. Rationale: traction weights must hang freely and provide continuous prescribed traction. A weight resting on the floor cannot exert the intended force. The nurse should correct the mechanical problem while maintaining prescribed alignment. The nurse should not independently increase the amount of weight. Question 4. A client with a newly applied plaster cast for a forearm fracture is preparing for discharge. The client asks why the nurse repeatedly checks finger movement, sensation, skin color, temperature, and capillary refill. Which explanation by the nurse is most appropriate? A. These assessments determine whether the fracture is healing correctly. B. These assessments help determine whether you are developing an infection. C. These assessments help detect impaired circulation or nerve function caused by swelling or pressure. D. These assessments are mainly performed to determine whether you need additional pain medication. Answer: C. These assessments help detect impaired circulation or nerve function caused by swelling or pressure. Rationale: casts can become restrictive as postoperative or traumatic swelling increases. Frequent neurovascular assessments help identify impaired circulation or nerve function early. Changes in sensation, movement, color, temperature, capillary refill, or pulses may indicate a serious complication. Question 5. A client with a lower leg fracture develops severe swelling several hours after injury. The client reports escalating pain despite for opioid administration. The nurse notes increasing paresthesia and a tense, firm calf. Which intervention should the nurse anticipate if acute compartment syndrome is confirmed? A. Surgical fasciotomy to relieve pressure within the compartment. B. Application of an additional compression dressing. C. Increasing the prescribed traction weight. D. Administration of a larger dose of opioid and continued observation. Answer: A. Surgical fasciotomy to relieve pressure within the compartment. Rationale: acute compartment syndrome can compromise tissue perfusion and cause irreversible muscle and nerve injury. When clinically significant compartment syndrome is confirmed, urgent surgical fasciotomy may be required to decompress the affected compartment. Analgesia does not treat the underlying cause. Question 6. A client with a tibial fracture has been placed in skeletal traction. The nurse is assessing the pin sites at the beginning of the shift. Which finding requires the greatest concern? A. A small amount of dried crust around the pin. B. Mild tenderness immediately after repositioning. C. Slight discomfort when the surrounding skin is palpated. D. Purulent drainage accompanied by increasing redness and warmth. Answer: D. Purulent drainage accompanied by increasing redness and warmth. Rationale: purulent drainage, increasing redness, and warmth around a skeletal traction pin strongly suggest pin site infection. Infection can progress to deeper tissue or bone infection and requires prompt evaluation. Minor crusting can occur around pin sites, depending on the stage of healing and local care protocol. Question 7. A client with a long leg cast reports that the affected foot feels unusually cold. On assessment, the nurse finds pallor of the toes, capillary refill of 5 seconds, diminished dorsalis pedis pulse compared with the unaffected extremity, and increasing numbness. What is the nurse's priority action? A. Encourage the client to wiggle the toes for 10 minutes. B. Notify the healthcare provider immediately about the acute neurovascular changes. C. Place a heating pad over the cast. D. Reassess the extremity after the next scheduled analgesic dose. Answer: B. Notify the healthcare provider immediately about the acute neurovascular changes. Rationale: pallor, coolness, delayed capillary refill, diminished pulse, and numbness indicate significant neurovascular compromise. This is not an expected finding that should simply be observed. Immediate intervention is necessary to prevent tissue ischemia and possible permanent damage. Question 8. A client has a newly applied plaster cast following reduction of a tibial fracture. The nurse needs to reposition the client shortly after the cast is applied. Which technique is most appropriate? A. Support the cast with the palms of the hands while repositioning. B. Grasp the cast firmly with the fingertips to prevent movement. C. Place the cast directly on a hard surface to maintain alignment. D. Cover the cast tightly with blankets to prevent it from becoming cold. Answer: A. Support the cast with the palms of the hands while repositioning. Rationale: a newly applied plaster cast requires careful handling while it is drying. The nurse should support it with the palms rather than fingertips, because concentrated fingertip pressure can create indentations that later become pressure points against the underlying skin. Question 9. A client is receiving skeletal traction for a femoral fracture. During routine care, the client asks the nurse to temporarily remove the traction weights so the client can change position independently. Which response is most appropriate? A. You may remove the weights as long as you replace them immediately afterward. B. The weights can be removed whenever you need to turn in bed. C. The traction should remain continuous unless specifically prescribed otherwise. D. You can remove the weights if another nurse is present. Answer: C. The traction should remain continuous unless specifically prescribed otherwise. Rationale: traction is prescribed to maintain alignment and reduce muscle spasm. In skeletal traction, the prescribed force generally needs to remain continuous. Removing the weights without an order can disrupt alignment and reduce therapeutic effectiveness. Repositioning should be performed while maintaining the prescribed traction system. Question 10. A client with a tibial fracture has been monitored closely for compartment syndrome. Initially, the client had severe pain and increasing paresthesia with a tense calf. Several hours later, the nurse observes that the client reports unexpectedly little pain, but the foot is now cool, pale, and markedly weak with almost no palpable distal pulse. Which interpretation is most appropriate? A. The compartment pressure has resolved because the pain has decreased. B. The client is experiencing the expected progression of fracture-related swelling. C. The opioid medication is now controlling the client's pain effectively. D. The decrease in pain may indicate advanced nerve and muscle ischemia rather than improvement. Answer: D. The decrease in pain may indicate advanced nerve and muscle ischemia rather than improvement. Rationale: a sudden decrease or disappearance of pain in a client who previously had severe compartment syndrome symptoms does not necessarily mean improvement. Advanced ischemia can damage nerves and muscles, reducing the ability to perceive pain. A cool, pale extremity with severe pulse diminution is an emergency requiring immediate intervention. Question 11. A 64-year-old client with a history of osteoporosis sustains a closed tibial fracture after falling down several stairs. A long leg cast is applied after reduction. 8 hours later, the client tells the nurse, "My leg feels like it is being squeezed from the inside." The nurse notes increasing swelling of the toes and reports of numbness along the dorsum of the foot. The toes remain pink, and the dorsalis pedis pulse is palpable. Which action should the nurse take? A. Reassure the client because the intact pulse indicates adequate circulation. B. Notify the healthcare provider promptly about the increasing pressure and sensory changes. C. Encourage the client to repeatedly flex and extend the ankle. D. Apply a heating pad over the cast to improve circulation. Answer: B. Notify the healthcare provider promptly about the increasing pressure and sensory changes. Rationale: increasing pressure, swelling, and new paresthesia after cast application may indicate developing neurovascular compromise or compartment syndrome. A palpable pulse does not exclude compartment syndrome because peripheral pulses can remain present despite elevated compartment pressure. Question 12. A client with a femoral fracture is receiving balanced skeletal traction. During morning care, the nurse observes that the client's body has shifted laterally and the affected leg is no longer aligned with the traction apparatus. The prescribed traction weights remain suspended freely. The client reports increased muscle spasms in the thigh. Which action is most appropriate? A. Increase the traction weight until the spasms stop. B. Remove the traction weights and reposition the client completely. C. Reestablish proper body alignment while maintaining the prescribed traction. D. Place a pillow directly underneath the knee to bend the affected leg. Answer: C. Reestablish proper body alignment while maintaining the prescribed traction. Rationale: effective traction depends on proper body alignment, countertraction, and freely hanging prescribed weights. Malalignment can increase muscle spasm and interfere with fracture alignment. The nurse should correct positioning while preserving the prescribed traction system rather than independently changing the weight. Question 13. A client with a newly applied fiberglass cast for a forearm fracture is being discharged. The client asks whether it is safe to place the cast underneath the shower stream because fiberglass doesn't dissolve in water. Which response is most appropriate? A. Protect the cast from moisture unless the healthcare provider specifically says it is waterproof. B. Fiberglass casts can always be submerged in water without precautions. C. Water is safe as long as the cast is dried with a hair dryer afterward. D. You should soak the cast daily to prevent the skin underneath from becoming dry. Answer: A. Protect the cast from moisture unless the healthcare provider specifically says it is waterproof. Rationale: not every fiberglass cast system is waterproof. Moisture can become trapped beneath the cast and contribute to skin maceration, irritation, and infection. The client should follow the specific cast care instructions provided by the orthopedic team. Question 14. A client is admitted after a crush injury to the lower leg. No fracture is identified on imaging, but the client develops progressively worsening pain and swelling. The nurse notes that the pain is significantly greater than expected from the apparent injury, and that passive extension of the toes produces severe pain. Which additional assessment finding would most strongly support the nurse's concern for acute compartment syndrome? A. Mild bruising around the ankle. B. Capillary refill of 2 seconds. C. Increasing firmness of the affected compartment. D. Ability to move the toes on command. Answer: C. Increasing firmness of the affected compartment. Rationale: a tense or firm compartment, especially when accompanied by escalating pain and pain with passive stretch, strongly supports concern for acute compartment syndrome. Early compartment syndrome may occur even without a fracture, particularly after crush injuries. Normal capillary refill, pulses, or movement do not reliably exclude the condition. Question 15. A client with a long arm cast reports severe itching beneath the cast. The skin surrounding the cast is intact, and the client has no numbness, increasing pain, or discoloration of the fingers. Which instruction should the nurse provide? A. Insert a cotton swab underneath the cast to scratch the skin. B. Pour rubbing alcohol underneath the cast to decrease itching. C. Use a sharp object to gently scratch the affected area. D. Avoid inserting objects beneath the cast and use safer measures recommended by the healthcare team. Answer: D. Avoid inserting objects beneath the cast and use safer measures recommended by the healthcare team. Rationale: inserting objects beneath a cast can cause skin abrasions, pressure injuries, and infection. The client should never use pens, rulers, hangers, or other objects to scratch beneath the cast. Persistent or severe itching should be reported, so appropriate cast care measures can be recommended. Question 16. A client with a tibial fracture is receiving skeletal traction. During the nurse's assessment, the client reports new numbness in the foot. The nurse finds that the foot is warm, capillary refill is 2 seconds, and the pedal pulse is present. Which interpretation is most appropriate? A. The numbness is expected because traction temporarily decreases nerve function. B. The client may have developing neurovascular compromise despite preserved arterial perfusion. C. The intact pulse confirms that the traction is functioning correctly. D. The nurse should wait until the next scheduled assessment before reporting the finding. Answer: B. The client may have developing neurovascular compromise despite preserved arterial perfusion. Rationale: new sensory changes are clinically significant, even when the extremity remains warm with a palpable pulse. Nerve compression or rising tissue pressure can occur before major arterial perfusion becomes compromised. The change should be promptly assessed and reported. Question 17. A client with an open tibial fracture undergoes surgical fixation and is subsequently placed in a lower leg cast. 12 hours later, the client reports worsening pain and numbness. The nurse observes swelling of the toes. Which finding would make the nurse most concerned that the client's condition is progressing towards severe vascular compromise? A. Mild swelling that improves when the leg is elevated. B. Warm toes with brisk capillary refill. C. Increasing pain that responds to prescribed analgesia. D. A progressively weaker distal pulse accompanied by pallor and coolness. Answer: D. A progressively weaker distal pulse accompanied by pallor and coolness. Rationale: a progressively diminishing pulse together with pallor and coolness indicates significant deterioration in arterial perfusion. This represents a late and serious neurovascular finding and requires immediate intervention. Earlier symptoms such as pain and paresthesia should already have prompted concern. Question 18. A client has a newly applied plaster cast following reduction of a displaced ankle fracture. The nurse is caring for the client during the first several hours after application. Which intervention is most appropriate to reduce swelling while maintaining safe positioning? A. Elevate the affected extremity as prescribed and perform frequent neurovascular assessments. B. Place the affected extremity below heart level continuously. C. Apply direct pressure over the cast to prevent swelling. D. Keep the extremity completely immobile and discontinue neurovascular assessments once the pulse is present. Answer: A. Elevate the affected extremity as prescribed and perform frequent neurovascular assessments. Rationale: elevation can help reduce postoperative or traumatic swelling, while frequent neurovascular assessments detect early changes in circulation or nerve function. A present pulse does not eliminate the need for continued monitoring. Question 19. A client with a femoral fracture has been placed in skeletal traction. While performing a bed bath, The nurse notices that the traction rope has slipped out of the pulley. The client is comfortable and reports no new pain. Which action should the nurse take? A. Leave the rope where it is because the client has no symptoms. B. Add additional weight to compensate for the displaced rope. C. Restore the prescribed traction setup and verify that the weights hang freely. D. Remove the traction system and notify the healthcare provider after completing the bath. Answer. C. Restore the prescribed traction setup and verify that the weights hang freely. Rationale. A displaced rope disrupts the mechanics of traction even if the client is initially asymptomatic. The nurse should restore the system according to the prescribed setup and ensure that the weights hang freely. The amount of traction should not be independently increased. Question 20. A client is being evaluated for possible acute compartment syndrome after sustaining a tibial fracture. The nurse notes severe pain despite opioid administration, pain with passive toe movement, increasing paresthesia, and a tense calf. The healthcare provider asks whether the presence of a pedal pulse makes compartment syndrome unlikely. Which response by the nurse is most accurate? A. Yes. Compartment syndrome generally causes loss of the pulse before other findings occur. B. Yes. A palpable pulse means the pressure is not affecting tissue perfusion. C. Only if the capillary refill is also delayed should compartment syndrome be considered. D. No. A distal pulse may remain palpable even when compartment pressure is dangerously elevated. Answer. D. No. A distal pulse may remain palpable even when compartment pressure is dangerously elevated. Rationale. Distal pulses can remain intact in acute compartment syndrome, particularly during earlier stages. The combination of escalating pain, pain with passive stretch, paresthesia, and a tense compartment is far more concerning than pulse presence alone. Waiting for pulselessness can delay treatment and result in irreversible tissue damage. Question 21. A 31-year-old client sustains a tibial shaft fracture during a sports injury and undergoes closed reduction followed by application of a long leg cast. 12 hours later, the client reports that the pain has changed from a localized aching sensation to a deep, constant pain that feels much worse than the fracture itself. The prescribed opioid provides minimal relief. The nurse notes increasing swelling and tightness of the calf. Which additional finding would provide the strongest evidence that the client may be developing acute compartment syndrome? A. Pain produced by passive stretching of the toes. B. Mild bruising around the fracture site. C. Warm skin over the affected extremity. D. A palpable dorsalis pedis pulse. Answer. A. Pain produced by passive stretching of the toes. Rationale. Pain with passive stretch is an important early clinical finding in acute compartment syndrome, particularly when combined with escalating pain that is disproportionate to the injury and poorly responsive to analgesia. A warm extremity and palpable pulse do not exclude the condition. Question 22. A client with a newly applied cast for a distal radius fracture reports increasing pressure in the hand. On assessment, the nurse finds moderate swelling of the fingers but no numbness, discoloration, or loss of movement. Which intervention is most appropriate at this time? A. Insert a tongue depressor underneath the cast to create additional space. B. Elevate the affected extremity and continue frequent neurovascular assessments. C. Cut the cast open without notifying the orthopedic team. D. Encourage the client to keep the hand below heart level. Answer. B. Elevate the affected extremity and continue frequent neurovascular assessments. Rationale. Elevation can help reduce swelling after cast application, while ongoing neurovascular assessments are essential for detecting deterioration. The nurse should not insert objects beneath the cast or independently remove it. Question 23. A client with a femoral fracture is receiving skeletal traction. During assessment, the nurse notes that the prescribed 8 kilograms weight is hanging freely, but the client has placed a heavy pillow underneath the thigh because of discomfort. Which action should the nurse take? A. Leave the pillow in place because it improves comfort. B. Add another pillow underneath the thigh to distribute pressure. C. Remove the pillow and reassess the client's alignment and traction system. D. Increase the traction weight because the pillow is reducing the pulling force. Answer. C. Remove the pillow and reassess the client's alignment and traction system. Rationale. Objects placed beneath the affected limb can alter alignment and interfere with the intended mechanics of traction. The nurse should assess positioning and maintain the prescribed traction setup. Traction weights should remain unchanged unless specifically ordered. Question 24. A client with a lower leg cast reports numbness and tingling in the toes. The nurse finds that the toes are pale and cool, capillary refill is 5 seconds, and the pedal pulse is difficult to palpate. Which finding represents the most immediate concern? A. The client reports mild discomfort beneath the cast. B. The cast has been in place for less than 24 hours. C. The client is unable to see the injured leg beneath the cast. D. The affected extremity demonstrates worsening arterial perfusion. Answer: D. The affected extremity demonstrates worsening arterial perfusion. Rationale: pallor, coolness, delayed capillary refill, and a diminished pulse indicate significant vascular compromise. This requires immediate intervention to prevent ischemic injury. The duration of cast placement does not make these findings expected. Question 25. A client with a tibial fracture develops suspected compartment syndrome. The healthcare provider orders measurement of compartment pressure because the clinical findings are concerning but not completely definitive. The client asks why the measurement is necessary. Which response by the nurse is most accurate? A. The measurement helps determine whether pressure within the muscle compartment is dangerously elevated. B. The measurement determines whether your fracture has completely healed. C. The measurement tells us whether you have developed a bone infection. D. The measurement determines how much opioid medication you should receive. Answer: A. The measurement helps determine whether pressure within the muscle compartment is dangerously elevated. Rationale: compartment pressure measurement can support the diagnosis when clinical findings are uncertain. Increasing pressure within a closed facial compartment can compromise microcirculation and eventually cause muscle and nerve ischemia. Question 26. A client is discharged with a fiberglass cast after sustaining a forearm fracture. 2 days later, the client calls the orthopedic clinic and reports a foul odor coming from inside the cast. The client also reports increasing pain that was not present the previous day. Which instruction should the nurse provide? A. Pour a small amount of antiseptic solution into the cast. B. Use a hair dryer on the highest setting to dry the inside of the cast. C. Schedule an urgent evaluation because the odor and increasing pain may indicate a complication. D. The odor is expected because the skin cannot breathe beneath the cast. Answer: C. Schedule an urgent evaluation because the odor and increasing pain may indicate a complication. Rationale: a new foul odor accompanied by increasing pain can indicate skin breakdown, infection, or another cast-related complication. The client should be evaluated rather than attempting to treat the problem by putting liquids or objects inside the cast. Question 27. A client with a femoral fracture is receiving skeletal traction. The nurse observes that the client is repeatedly sliding downward in bed, causing the body to press against the footboard. The traction weights remain suspended. Which nursing action is most appropriate? A. Increase the traction weight to pull the client upward. B. Reposition the client while preserving the prescribed traction and ensuring adequate countertraction. C. Remove the traction weights while the client is repositioned. D. Place the weights directly on the bed to prevent excessive traction. Answer: B. Reposition the client while preserving the prescribed traction and ensuring adequate countertraction. Rationale: proper body positioning and countertraction are essential to maintain the effectiveness of traction. The client should be repositioned while the prescribed traction is maintained. The nurse should not independently alter the traction weight. Question 28. A client with a lower leg fracture is being assessed 6 hours after cast application. The client reports severe pain and says, "The pain gets much worse whenever you move my toes." The nurse observes increasing swelling and a tense calf. Which action should the nurse avoid? A. Reporting the findings immediately. B. Performing a focused neurovascular assessment. C. Continuing to monitor the extremity closely while urgent evaluation is arranged. D. Delaying notification until the client develops a completely absent pedal pulse. Answer: D. Delaying notification until the client develops a completely absent pedal pulse. Rationale: waiting for pulselessness is dangerous. A palpable pulse can remain present despite clinically significant compartment syndrome. Severe pain, pain with passive stretch, swelling, and a tense compartment are sufficient reasons for urgent evaluation. Question 29. A client with a newly applied cast is being taught how to monitor the affected extremity at home. Which statement by the client demonstrates correct understanding? A. If my fingers or toes become numb, I should report it promptly. B. A cold, pale extremity is normal during the first few days. C. If the cast feels tighter, I can loosen it with scissors. D. I should wait until my next appointment before reporting increasing pain. Answer: A. If my fingers or toes become numb, I should report it promptly. Rationale: new numbness or tingling may indicate nerve compression or impaired neurovascular function and should be reported promptly. Increasing pain, discoloration, coolness, swelling, impaired movement, or changes in sensation also require timely evaluation. Question 30. A client with a crush injury to the lower leg is admitted for observation because of concern for compartment syndrome. At the beginning of the shift, the client has severe pain, paresthesia, and a tense calf. 4 hours later, the nurse observes profound weakness of the affected foot, increasing pallor, coolness, and a markedly diminished pulse. Which conclusion should the nurse make? A. The client is demonstrating expected recovery from compartment syndrome. B. The analgesic regimen has become effective. C. The neurovascular status has deteriorated and the condition may now be advanced. D. The findings indicate that swelling has begun to resolve. Answer: C. The neurovascular status has deteriorated and the condition may now be advanced. Rationale: progression from pain and paresthesia to weakness, pallor, coolness, and diminished pulses indicates worsening neurovascular compromise. These are late and ominous findings that may indicate advanced ischemia. Immediate intervention is required to prevent permanent tissue damage. Question 31. A 72-year-old client with a tibial fracture has a long leg cast applied after closed reduction. During the first several hours, the nurse performs repeated neurovascular assessments. The client initially reports moderate pain that improves with medication. 8 hours later, the client reports rapidly increasing pain that is now severe and says the leg feels extremely tight. The nurse notes increasing swelling and pain when the toes are passively extended. Which action should the nurse take first? A. Reassure the client that swelling is expected after fracture reduction. B. Place the affected leg in a dependent position. C. Administer another dose of opioid and reassess in 30 minutes. D. Immediately report the findings as possible acute compartment syndrome. Answer: D. Immediately report the findings as possible acute compartment syndrome. Rationale: severe escalating pain that is poorly controlled by analgesia, increasing tightness, swelling, and pain with passive stretch are highly concerning for acute compartment syndrome. This is a time-sensitive emergency requiring immediate evaluation rather than delayed reassessment after analgesia. Question 32. A client with a femoral fracture is receiving skeletal traction. The nurse observes that the traction weights are hanging freely and the ropes are positioned correctly. However, the client's body is rotated toward the unaffected side, and the affected leg is no longer aligned with the direction of traction. Which intervention is most appropriate? A. Reposition the client to restore proper alignment while maintaining the traction. B. Remove the weights and restart traction after the client is repositioned. C. Increase the prescribed traction weight to compensate for the rotation. D. Ask the client to rotate the affected leg independently into alignment. Answer: A. Reposition the client to restore proper alignment while maintaining the traction. Rationale: proper body alignment is essential for effective traction. The nurse should correct the client's position while maintaining the prescribed traction system. Independently changing the traction weight or removing the weights is inappropriate. Question 33. A client with a new short arm cast reports that the fingers are increasingly swollen. The nurse finds that the client can move all fingers. Capillary refill is 2 seconds, and the fingers remain warm and pink. The client asks why the nurse is still concerned even though the circulation appears adequate. Which response is best? A. A palpable pulse means swelling will eventually cause nerve damage. B. Changes can develop later, so continued neurovascular monitoring is necessary. C. Any swelling after a cast is applied means the cast must be removed. D. Finger movement is not useful when assessing a casted extremity. Answer: B. Changes can develop later, so continued neurovascular monitoring is necessary. Rationale: neurovascular compromise can develop progressively as post-injury swelling increases. Normal findings at one point do not guarantee that the extremity will remain adequately perfused or neurologically intact. Serial assessments are essential after cast application. Question 34. A client with a tibial fracture develops suspected compartment syndrome. The healthcare provider determines that urgent surgical decompression is necessary. The client's family asks why surgery is required when the fracture itself has already been immobilized. Which explanation by the nurse is most accurate? A. The surgery is primarily performed to strengthen the fractured bone. B. The surgery prevents the cast from becoming damaged. C. The surgery releases pressure within the affected muscle compartment. D. The surgery prevents all postoperative swelling from occurring. Answer: C. The surgery releases pressure within the affected muscle compartment. Rationale: fasciotomy involves opening the affected facial compartment to relieve dangerously elevated pressure. The goal is to restore tissue perfusion and prevent irreversible muscle and nerve damage. It is not performed simply to stabilize the fracture or prevent ordinary swelling. Question 35. A client with a long arm cast calls the orthopedic clinic and reports increasing pain beneath the cast. The client says, "I thought the pain would be getting better, but it is becoming worse every hour." Which additional report would require the nurse to instruct the client to seek immediate evaluation? A. My fingers are slightly swollen after I have been sitting upright. B. The cast feels heavier than my arm did before the fracture. C. The skin around the edge of the cast feels slightly dry. D. My fingers are becoming numb and difficult to move. Answer: D. My fingers are becoming numb and difficult to move. Rationale: increasing pain combined with new numbness and impaired movement suggests possible neurovascular compromise. This requires immediate assessment. Mild swelling, dryness, or the sensation that the cast is heavy are not equivalent emergency findings when occurring without neurovascular changes. Question 36. A client is receiving skeletal traction for a femoral fracture. During the shift, the client asks the nurse to place the traction weights on the mattress because the weights are too noisy. What should the nurse explain? A. The weights need to hang freely so the prescribed traction force is maintained. B. The weights can rest on the mattress as long as the rope remains attached. C. The weights should be removed whenever they interfere with sleep. D. The weights can be supported by pillows during periods of rest. Answer: A. The weights need to hang freely so the prescribed traction force is maintained. Rationale: traction weights must hang freely without resting on the floor, mattress, or other surfaces. Supporting the weights changes the amount of force being applied and can compromise fracture alignment and treatment effectiveness. Question 37. A client with a newly applied lower leg cast tells the nurse that the cast became wet while the client was washing. The cast feels damp several centimeters above the ankle. Which action should the nurse take? A. Cover the wet portion with plastic and leave it covered until completely dry. B. Assess the cast and skin and follow the prescribed cast drying and care instructions. C. Insert absorbent material underneath the cast to remove the moisture. D. Place the extremity directly against a high-temperature heat source. Answer: B. Assess the cast and skin and follow the prescribed cast drying and care instructions. Rationale: moisture trapped beneath a cast can contribute to skin maceration and breakdown. The nurse should assess the cast and affected skin as appropriate and follow the healthcare team's instructions for drying and cast care. Heat sources should not be used indiscriminately because they can injure the skin. Question 38. A client with a tibial fracture is suspected of having acute compartment syndrome. The nurse performs a neurovascular assessment. Which combination of findings is most concerning? A. Mild edema, warm skin, and capillary refill of 2 seconds. B. Mild pain relieved by prescribed medication and intact sensation. C. Severe pain, pain with passive stretch, paresthesia, and a tense compartment. D. Moderate bruising, palpable pulse, and full active toe movement. Answer. C. Severe pain, pain with passive stretch, paresthesia, and a tense compartment. Rationale. This combination represents the classic progression of concerning findings for acute compartment syndrome. Severe pain disproportionate to the injury, pain with passive stretch, sensory changes, and a tense compartment warrant urgent evaluation. A palpable pulse does not exclude the diagnosis. Question 39. A client with a plaster cast is being repositioned 2 hours after application. The nurse notices that the cast is still soft. Which technique should the nurse use when handling the cast? A. Support the cast with the palms of the hands. B. Grip the cast firmly using the fingertips. C. Place the client's weight directly on the softest portion. D. Compress the cast gently to speed the drying process. Answer. A. Support the cast with the palms of the hands. Rationale. A fresh plaster cast can be damaged by concentrated pressure. Supporting it with the palms distributes pressure over a larger area and reduces the risk of creating indentations that could become pressure points against the skin. Question 40. A client with a lower leg fracture has been receiving close neurovascular monitoring because of concern for compartment syndrome. Which assessment change should the nurse report immediately rather than attributing it to expected post-fracture swelling? A. Mild edema that remains unchanged from the previous assessment. B. Slight bruising around the fracture site. C. Mild discomfort that improves after prescribed analgesia. D. Increasing pain accompanied by new paresthesia and decreased sensation. Answer. D. Increasing pain accompanied by new paresthesia and decreased sensation. Rationale. Increasing pain with new sensory changes is concerning for worsening compartment pressure and neurovascular compromise. A stable amount of edema or bruising may occur after a fracture, but progressive neurologic symptoms require immediate attention. Question 41. A 46-year-old client with a tibial fracture has a long leg cast applied after reduction. During the evening assessment, the client reports that the pain has become progressively worse despite receiving prescribed analgesia. The nurse observes increased swelling and notes that the client experiences severe pain when the toes are passively extended. Which additional finding would be most concerning if it appeared next? A. Mild bruising around the fracture site. B. Increasing numbness of the affected foot. C. Slight itching beneath the cast. D. Moderate swelling that decreases with elevation. Answer. B. Increasing numbness of the affected foot. Rationale. New or worsening paresthesia/numbness in a client who already has severe pain, swelling, and pain with passive stretch suggests progression of neurovascular compromise and possible acute compartment syndrome. Immediate evaluation is required. Question 42. A client with a femoral fracture is receiving skeletal traction. During the nurse's assessment, the prescribed weights are hanging freely, but the traction rope is rubbing against the side of the pulley rather than moving smoothly through it. The client reports increased discomfort in the affected leg. Which action is most appropriate? A. Add additional weight to overcome the friction. B. Remove the traction weights and leave them off until the next shift. C. Correct the mechanical alignment of the traction system and reassess the client. D. Ask the client to pull against the traction to maintain the prescribed force. Answer. C. Correct the mechanical alignment of the traction system and reassess the client. Rationale. Traction must operate with the rope moving freely through the pulley and the prescribed weights hanging freely. Friction can alter the effective traction force and compromise treatment. The nurse should correct the setup rather than independently changing the weight. Question 43. A client with a newly applied cast for an ankle fracture asks the nurse which symptom should be reported immediately after discharge. Which client statement demonstrates the greatest understanding of the instructions? A. I will report increasing pain that isn't relieved by my medication, especially if my toes become numb or discolored. B. I will report mild itching because it means the cast is damaging my skin. C. I will loosen the cast myself if it becomes uncomfortable. D. I only need to report problems if the cast cracks completely. Answer. A. I will report increasing pain that isn't relieved by my medication, especially if my toes become numb or discolored. Rationale: increasing pain that is disproportionate or poorly relieved by analgesia, particularly when accompanied by numbness, discoloration, coolness, or impaired movement, can indicate neurovascular compromise or compartment syndrome. These findings require prompt evaluation. Question 44. A client with a lower leg fracture develops suspected compartment syndrome. The nurse notices that the client has severe pain with passive toe movement and a tense calf. The client's pedal pulse is still strong. The client's family says, "That's reassuring because the pulse is normal." Which response by the nurse is most appropriate? A. Yes, a normal pulse completely rules out compartment syndrome. B. The pulse is useful, but it can remain present even when compartment pressure is dangerously high. C. The pulse only becomes abnormal after the fracture has healed. D. A normal pulse means we can safely wait several hours before reassessing. Answer: B. The pulse is useful, but it can remain present even when compartment pressure is dangerously high. Rationale: a preserved distal pulse does not exclude acute compartment syndrome. Compartment pressure can first compromise microcirculation and venous return while major arterial flow remains detectable. Waiting for pulselessness can delay limb-saving treatment. Question 45. A client with a tibial fracture is placed in skeletal traction. The nurse observes that the prescribed traction weight is hanging freely, but the client has moved upward in the bed and the buttocks are now pressed firmly against the headboard. Which nursing action is most appropriate? A. Increase the traction weight by 2 kilograms. B. Remove the traction weights before repositioning the client. C. Place a pillow beneath the client's knees. D. Reposition the client to restore proper body alignment while maintaining the prescribed traction. Answer: D. Reposition the client to restore proper body alignment while maintaining the prescribed traction. Rationale: proper body alignment and countertraction are essential for effective traction. The client should be repositioned while preserving the prescribed traction system. The nurse should not independently increase or remove traction weights. Question 46. A client with a long leg cast reports increasing pain and pressure beneath the cast. The nurse observes that the affected foot is warm and that the client can move the toes. However, the client describes the pain as severe and states that the prescribed analgesic has provided almost no relief. Which interpretation is most appropriate? A. The intact movement and warmth prove that there is no serious complication. B. The pain is expected because all fractures remain painful for several days. C. The severity and poor response to analgesia warrant evaluation for a developing complication. D. The client should receive another analgesic dose before any further assessment is performed. Answer: C. The severity and poor response to analgesia warrant evaluation for a developing complication. Rationale: pain disproportionate to the injury or poorly relieved by analgesia is an important warning sign, especially after a fracture with significant swelling. Preserved warmth and movement do not reliably exclude early compartment syndrome or other complications. The client requires further assessment and timely escalation. Question 47. A client with a fiberglass cast tells the nurse that a small crack has developed along the cast near the ankle. The client can move the toes normally, has intact sensation, and reports no increase in pain. What should the nurse do? A. Assess the integrity and function of the cast and notify the orthopedic team according to the cast care plan. B. Tell the client to place tape over the crack and continue normal activity. C. Instruct the client to remove the cast at home. D. Apply additional compression around the cracked area. Answer: A. Assess the integrity and function of the cast and notify the orthopedic team according to the cast care plan. Rationale: a cracked cast may no longer provide adequate immobilization or support. The cast should be evaluated to determine whether repair or replacement is necessary. The client should not independently modify or remove the cast. Question 48. A client with a tibial fracture is being monitored for compartment syndrome. The nurse notices that the client's pain, which had been severe earlier, suddenly decreases. At the same time, the client develops profound weakness of the foot, numbness, pallor, and a barely palpable pedal pulse. Which interpretation is most accurate? A. The compartment syndrome has resolved spontaneously. B. The client is experiencing the expected effect of opioid medication. C. The fracture is beginning to heal and swelling is decreasing. D. The sudden reduction in pain may reflect advanced ischemic nerve and muscle damage. Answer: D. The sudden reduction in pain may reflect advanced ischemic nerve and muscle damage. Rationale: a sudden reduction in pain in the setting of worsening weakness, numbness, pallor, and diminished pulse is not reassuring. Advanced ischemia can impair nerve function and reduce pain perception. This represents severe neurovascular deterioration requiring emergency intervention. Question 49. A client with skeletal traction for a femoral fracture is being assessed before receiving a bed bath. The nurse notices that one of the traction weights is resting on the floor. The client reports no pain and has an intact neurovascular assessment. Which action is most appropriate? A. Leave the weight on the floor because the client's assessment is normal. B. Replace the weight with a heavier one to ensure adequate traction. C. Restore the prescribed weight so that it hangs freely and verify the entire traction setup. D. Remove all traction weights and document that the client is stable. Answer: C. Restore the prescribed weight so that it hangs freely and verify the entire traction setup. Rationale: the traction weight must hang freely to provide the prescribed force. A weight resting on the floor reduces or eliminates the intended traction. The nurse should restore the prescribed setup and verify alignment without independently changing the amount of weight. Question 50. A client with a tibial fracture is receiving a long leg cast and has been monitored closely for neurovascular complications. The nurse compares the current assessment with the previous assessment and identifies increasing pain, worsening paresthesia, decreased active toe movement, and a progressively tense calf. The pedal pulse remains palpable. Which action is the priority? A. Document the findings and continue routine monitoring because the pulse is present. B. Promptly escalate the findings for immediate evaluation of possible acute compartment syndrome. C. Encourage the client to ambulate to improve circulation. D. Apply a heating pad over the cast and reassess after 30 minutes. Answer: B. Promptly escalate the findings for immediate evaluation of possible acute compartment syndrome. Rationale: the client has progressive pain, paresthesia, motor changes, and a tense compartment, which strongly indicates possible acute compartment syndrome. The presence of a pedal pulse does not rule it out. This is a limb-threatening emergency requiring immediate evaluation and possible surgical decompression. That's the end of all 50 questions. If you missed some, don't just memorize the answers. Review the clinical findings and understand why each option was right or wrong. Keep practicing difficult NCLEX-style questions, especially those involving neurovascular changes, casts, traction, and compartment syndrome. Keep studying, stay consistent, and good luck on your NCLEX.